Hi everyone, and welcome to the Confident Competence webinar. So my glamorous assistant, Faye, who's got her camera on, will make sure that people can come in. And if anybody has any questions throughout the course of this webinar, then please just put it in the chat box and Faye will pick it up. So if you want to keep them private, then just make sure in the chat box that you are referencing Faye within that and sending it to her. Otherwise, everybody will see the message. And then about the halfway point, Faye, I'm going to bring you in if you do have any questions. So you can always hold your questions to the end, but if you have any that are on your mind, then please just fire them in, because I will stop at around about 12:30 and just take a couple of those questions that may have come in. If you are giving up your lunchtime for this, thank you very much. I really appreciate it. And I hope what I give you today will allow you to go away with some thought on how you are doing things, and maybe allow you to think about a strategy and structure going forward for 2026 within your organization and people's development. I also am lucky here today because I have Elaine Warner with me. There we go. So Elaine Warner, for people that don't know, is the Managing Director of CBAT, which stands for Care Business Associate Training. And I will be leaning on her at certain points throughout this webinar. Just to let you know, whilst Elaine's remit is everything around training within the world of health and social care and beyond, her absolute speciality sits within children's services. So if we do have anybody here from children's services today, then please jump in with those questions, because Elaine's knowledge in that subject area is far superior to mine. Mine's very much adult care and tech services and things like that. And management and leadership. But we'll get on with the show. That'd be a good point to do that. So, as I said, any questions, just fire them through. We will keep it to an hour, I promise you, or slightly less. So what are we looking at today on our lunchtime hour? It's the importance and the key of linking competency assessments to your company's L&D plan. Now, what do we mean by that? The learning and development plan. And I'll just take you through a couple of slides just to showcase exactly what I'm talking about. You have all heard of this. I'm sure if you are regulated by CQC, the single assessment framework is something that's not new to you. And if you've had inspections over the course of the last 12 months, then the likelihood is you've been asked to give evidence on your competencies that you complete. Now, the issue around competencies, there's a couple of issues that sit with it. One is, first of all, writing competencies. What are you writing them against? How do you know that they're compliant? What's your aims and objectives? What's the outcomes? And a lot of people struggle in writing competencies because it's unfamiliar territory. Unless you are someone who has been brought up within the world of education and assessment, then it's very difficult for you to actually sit down and work out, am I covering all bases? And a lot of people that I speak to in the industry, they would struggle. In the case of most people, if they have to write a competency, they will at that point only Google a competency assessment and take one from the NHS, which will not be relevant to their workplace, but they'll spend hours trying to manipulate it so that it does. And in reality, from that situation, it's just very time consuming and normally very sporadic in terms of when they're done. So this, although was never really a huge issue, became a bigger issue when the single assessment framework came out, because within the single assessment framework, it was the first time it really pushed for competence. Now, we always done competence, if you're from the health and social care industry, we always done competence in things like medication. So you knew that you were competency assessing staff and medication, and you knew maybe fire evacuation drills and things like that. But really, there wasn't many other subjects that you'd done competency assessments in, unless you were a skilled nurse, for example, then you may be competency assessed within your clinical skills. So what we did as organizations, and certainly as training companies, Elaine, was we just put staff on training year on year on year, doing the same course, whether that's face-to-face, virtual classrooms, or e-learning. It was just a repetitive, what I like to refer to as the hamster's wheel, where we just keep going round and round and round, but we're not actually developing, and we're not actually competency assessing whether the actions of the learning are taking place on the floor in a practical sense. So within the single assessment framework, they really emphasize the word competence, which is why those that are getting inspected now will not only need to produce a training matrix that staff have completed, but they will also need to produce your evidence in relation to how you are competency assessing. And again, there is a little bit of a gray area that people stumble into on this, because the gray area, I'm being told that my screen is lagging a bit by someone. Is that correct, Elaine?
Yeah.
I'm not sure. I apologize if that's the case. Going back to what I was saying was that now you have to produce evidence of these competencies, and the grey area that people will step into is when they are looking at competencies, they may, with their e-learning provider, think, well, if my staff do the questions that were associated to the e-learning course, that would prove whether they were competent or not. That's not what the inspector is looking for. What the inspector is looking for is the practical element of the competence. So the theoretical element is one part, but it's a very small part. It's whether that theoretical knowledge is put into working practice within a practical situation, a practical scenario. And that's the care in which people deliver. So when CQC are asking for evidence of competence, what they're asking for is a physical document of some form that shows you observed practice and you were happy with the practice that was shown, and that should link to the training and development that you have been giving your staff. So it's no longer just the likes of medication that's a competency, it's everything from infection prevention control to moving and handling to medication as mentioned, fire evacuation, even down to some of your first aids. So think about all the different training courses you do. You need to provide evidence that that training has worked effectively. And that's things like communication as well, delivering person-centered care practices. So it's quite a remit of competencies that you would have to complete and start to build. And as I said, if you've been inspected, you may have already been asked to produce this. If you haven't been inspected, you will get asked to produce this. It normally is something that they will throw after the inspection when they send that nice email over the next 24 hours asking for a huge amount of documentations for you to send through. So that's why competence has become such a big thing. It's because of the single assessment framework. In fact, 61% of all quality statements within the framework mention the word competency. So that's 21 out of 34 in total. So you can see how it can affect your scoring quite a lot. So yes, 21 out of the 34, which can affect your scoring dramatically. So what does the regulator actually say about this? Well, they mandate that providers ensure staff at all levels possess the required qualifications, so that's the training side, competence, knowledge, skills, and experience to deliver safe and effective care. And this includes through your recruitment processes in terms of assessing staff's competence within that starting point. And if you think about the care certificate, when the care certificate came out, that was very much, it had competencies within it to pass the care certificate. So you can see where they're actually taking the remit from. It's a continuation as we go on. So it's important that this evolves into proper supervision and setting those KPIs, if you like, for the appraisal side of things. So we have to link it all in terms of when we're looking at that training side. So their key stance is that staff competence is a requirement. So providers must ensure that all individuals involved in regulated activities have necessary competence along with qualifications, knowledge, skills, and experience. So they continually are using this language. The provider's responsibility, they say, lies with the provider to have appropriate processes for assessing and checking that staff have the required qualification and competence. And within the working scope, They say that staff should only perform tasks for which they are competent and should be encouraged to seek help when they're asked to do something they're not prepared for. So ultimately, what they are saying when it comes to competence is that you have to show evidence. It's no good you just saying, no, I think they're competent. I've watched them. They're good. You have to produce physical evidence. You've all been in a situation and heard the language that if it's not written down, then it doesn't exist. And that's still the remit of CQC. So the evidence of processes of providers are expected to maintain relevant records of their competency assessments and development processes to demonstrate compliance during inspections. This isn't me saying this as a sales pitch to you. These are CQC's words. This is CQC's language. This is taken directly from them. So it's a critical element of CQC's regulations, particularly under Regulation 9 and Regulation 12, safe care and treatment. And it does form into another lot of regulations, which I'll go into further as we go along. What I'm trying to do at this very moment in time is to get your mindset to a point where you're thinking, are we doing competencies? How are we doing competencies? And how can we improve our competency assessments to showcase the evidence that we're going to have to need? And this is just from a regulator's perspective. Outside of that, from your business perspective, it's important that we also understand that, because as I said, it will form into supervisions and appraisals, which I'll explain more as we go on. So this is a bit where I'm probably going to just stop, because that first part was just explaining what we're talking about and why we're talking about competency so much and why you're hearing it mentioned a lot more. The reason why I want to stop for a moment is because I want us now to actually consider and think about the learning and development plan that we do with our teams. And I want you to ask yourself some critical questions. And if you've got pen and paper, take notes at this point of your own thinking, your own logic, so you can go away from this and explore and ask the right questions. First of all, when you are setting your learning and development plan, what is different from that plan to the year before and the year before and the year before that? Because the key here is the words learning and development. In other words, what are we teaching people? How are they learning that? And how is it helping to develop them? So what I want you to do, the first question I want you to ask yourself is, are we doing that? Now, you may turn around and say, yes, so I'm going to split this. If it was a new member of staff, are you doing that? If it's an existing member of staff, are you doing that? Because that's the first part of our learning development plan. If someone is on year 2, would they be needed to repeat everything they did in year 1 when it comes to learning and development? And in most cases, the answer is yes, that's what we are doing as services. And I want to really home in on that as we go along, because how is that learning and how is that development? You know, if people have heard me speak before, they'll probably heard me, I'm sure Elaine has heard me say it a lot of times, and that is, if you know the alphabet, why are you sending me back to a classroom to learn the alphabet? I already know it. I can already do it, and I'm quite confident that I can do it well. So on that basis, it would be an absolute waste of my time sending me back to a classroom year on year on year to teach me something that I know that I practice and I do it well. In other words, I'm very competent within it. Now, if you were sending me back to a classroom to learn the alphabet in Greek, that is something completely new to me. So I would have to learn it and I would have to develop my skills before I became competent within that. And that's what we need to think about in our learning and development plans. Because what you are doing in learning and development year on year on year is you're investing in people, you're investing in your team. And if you are, I'm sure some of you maybe own your own business or work within businesses where you are budgeted or you have to be put forward for your budget. And what every business is looking for in every penny that they spend is, what is my return on investment from this? Sometimes it can be what's my financial return, but what's my other beneficial returns that come from a return on investment? In other words, are my staff getting better year on year? Are we able to compete at higher levels year on year? That's the investment that you're putting in. Is there less safeguardings occurring or less medication errors occurring? Is there less falls from people? Is our occupancy higher? All these are return on investment models that you can actually utilize and look at. But if you are doing the same thing year on year on year, how are you measuring that return on investment? Can you measure that return on investment? So what I always say to people, if we look at bullet point 2, is stop repeating the same training, because the key is in the word development, which means progression. We are getting better, and we only get better when we learn new things, either by experience, mentoring, coaching, working with our peers, or being in a classroom learning something we didn't know, learning something that's going to change the culture, change the way that I think, maybe even change my values in certain minds. So we need to look at ways in which we can stop repeating that same training. And then we need to link it absolutely to what our business model is. So if we want to push more into a customer service area, how are we going to do that? If we want to push more to the private market, how are we going to do that? Because the investment needs to be through the training that's actually given to the team. And that can be from sales and marketing and all sorts that don't sit within that statutory and mandatory training that we seem to home in on. So we always need to look at what we're doing in terms of innovation. Now, the reason why I use the word innovation, it's a well-used word, is because I bet most of your company values have the word innovation within it. Just check if you're not sure. But you will find that a lot of them have that word innovation. So innovation has to come in through your learning and development plan as well. So what we need to try and do is save cost in mandatory, because that becomes a fixed cost that we do year on year, so we can push developmental training. Now, one of the things that Elaine does quite a lot is actually go to companies and do a full training plan review. So look at what they're doing, how they're doing it, and start to formulate a strategy. And Elaine, I'll bring you in at this point, if that's okay, because you've done this with a number of companies and you've found similar patterns all the time, haven't you? Do you want to explain what they are?
Yeah, I think you kind of hit the nail on the head when you talked about that repetitive training. And it's about making sure that training is done when it's required and it's not overly done. So recently, Skills for Care changed their training matrix in relation to how often training was supposed to be done. So one of the things that we're doing in training reviews is actually making sure that the training that they're currently getting is aligned to it. There's no point doing something annually if it doesn't need doing till every 3 years. So I think that's where a lot of the needless training comes in, because people think, well, it's e-learning, we have to do it every year, so we'll do it every year, but that's not needed. And there's also the kind of hidden costs with the e-learning. One organisation that we did a training review with, large organisation, was paying their staff to do their e-learning, and that doesn't happen in every organisation, I know, but we saved them £47,000 just by looking at their e-learning to say, why are you doing that? There's duplication in those 4 courses. Why are you doing 4 courses when that course has it all in? So as part of the training review, it's about looking at what e-learning are they doing? Where is the duplication? Where can we make it more cost effective? Where can we do blended learning? So it might be where, you've got some of your subjects, such as like fire, they might do e-learning on fire, but then we might go in and do a masterclass where it's just the practical stuff. We'll probably combine that in the day with things such as moving and handling, if it's a refresher. So it's about people having joined up thinking. And doing a training plan is about getting people to think outside of that box of, it's training, it's a tick box exercise, we're getting it done because we're told we need to get it done. But it's about making sure it is quality and it's cost effective, and it is about absolutely that development area. How is it looking in terms of their vision, mission, values? Where's the development for their staff? If they're home growing staff, but everybody's just doing the same training, and you hear it time and time again. If people are doing mandatory training, I could go on a training course with 30 years in the industry with somebody who was a new starter yesterday. And I'm going to sit in that training course going, this is a waste of time me being here. So it is about getting people to think about how we can change that training up. Blended learning, masterclasses, competency assessing is going to eliminate a lot of e-learning. And if not eliminate it, reduce it. So if somebody doesn't pass a competency, then it might be that they go and do an e-learning course, which might be more cost effective than putting them on a face-to-face training course, depending on what it is. So it is about all that joined up thinking and a fresh pair of eyes coming in to say, why are you doing that? How often are you doing that? What value are you getting from that?
Training reviews more and more, aren't you? Because companies are realizing the cost that they're spending. Because one part that you really talked there that's very important is the hidden cost that sits with training. And I will go into this when I give you a little bit of a cost analysis further along. But a lot of people, because staff in certain organizations, and the one you referred to, they would be paying their staff to do that training, but that payment would go on the payroll. So it never actually formulates on the, if you like, into the training budget because it's hidden. But when you actually bring it out and see it, that's when you realize you cannot be a kid in a sweet shop just picking lots of different e-learning courses and putting them on there, because everyone has a cost. Even though your e-learning provider may be turning around and saying, oh no, you have unlimited access to all the courses, doesn't mean that you should do every course. What you're doing in the main is you're picking titles of courses instead of actually looking at the content that sits behind the course to make sure it reflects on your business. And that's the bit. And Elaine, I'll just bring you in, because as part of that training review, the next step would be to actually set out the training strategy report for the company for the ongoing years at that point. And when you set out the training strategy, that's a key document to hand over to CQC, because it will showcase the pathways and the development and how you structured your training to them, which is far better than just handing over a training matrix. Yeah.
Absolutely. And like you say, there's, if we take, for example, the Oliver McGowan mandatory training, that has massive cost implications to organizations. So, but that might be part of their strategy. So part of the training is to then implement a kind of, a yearly plan, so they can plan for those things and, be looking at how many courses do they need based on staff, based on service. And, a training provider of their salt should be doing that with you. They should be sitting down having real honest conversations with you to say, how can we save you money? How can we make it more cost effective? Let's do a yearly plan. With some companies, we have a 3-yearly plan because they're large organizations. And it's kind of utilizing the experts within the field. And, that then frees up time for the organization to know that they're getting all the training that is required. It's all spaced out, it's laid out. So we're not being reactive, we're being proactive, which is a key thing with it. And I think that's kind of the key with it. And I know David has just put there, thank you, David, for that, saying if anybody does want any information or guidance, if you email me, I'll put my email in the chat, and then I can send you some guidance and the skills for care guidance that lays out when refreshers are required, because I think that's going to be something that maybe not everybody is aware of, that the guidance changed. So, it's things like that, that's what doing a training review is about.
Well, Elaine, just on that note, I did a training review for a company recently, and this one will blow your mind, because they had staff members doing 72 e-learning courses, 72. And we have reduced that down to 12. So it's a small care home as well, but literally they just allocated every course to every member of staff. And then when asked the question, are you paying staff to do this? The answer was yes. I mean, it was a ridiculous amount of money, and they were training staff in things that they would never do within that care setting. And that's not what it's set up for. Yeah, I used the reference kid in a sweet shop. We've got to be very mindful of that, because you can easily turn people away from learning. You can turn them off instead of turning them on, which is what we want to do with all learning, because unless we turn them on to learning, you won't see the development that you need. You've all had those moments, I'm sure, in a classroom where you've sat there and bored out your mind and your brain just switched off within 5 minutes. And some of you will have been in classrooms where there was a light bulb moment that happened that changed everything that you do, changed your sense of purpose, etc., like that. And that's what we need to do with education. We need to be enlightening people, empowering people, and wanting them to have a thirst to learn more, rather than bombarding them with stuff that they will never utilize on the floor. And that's a key aspect when it comes to a learning development plan. Now, it's just about to turn 12:30 already. So I did say at the 12:30 point, I would bring Faye in. Faye, I've probably got time to take a couple of questions before I move this on. So has anybody asked a question? If not, I can move on straight away.
Hi, Paul. So yeah, we've got two questions at the moment. So the first one is it best to have a 12-month or a 3-month training strategy?
3 months or 3 years? Sorry, 12 months or three months?
12 months or 3 years training
3 years. Okay, I was
strategy.
going to say a 3 month training strategy. Yeah, you could do that, but you're probably in a bit of trouble when you're trying to catch up on your training. A 12-month or 3 year strategy. My recommendation would always be to try and do a 3 year strategy. And the reason why I say that is because most business plans are written over a 3 year period. And once you've written your business plan, the key aspect of that is, well, what skill set would I need to develop within the team in order to be able to hit that the aims and goals of that business plan. Also, it filters in really nicely with the fact that most training courses now, and Elena said she'll send through the documentation that some of you may not have seen or attained. Most training courses have actually moved to a validity period of 3 years, as long as competencies are completed in the interim periods. So that allows you to quite nicely set out 3 year training strategy plans, and it also allows you to know what your budgetary spends are likely to be over that period, which is what all FDs want. If you're not thinking 3 years, 12 months is a minimum. You should be setting out your training plan of what you want to achieve over the next 12 months and what courses will be needed to do that. I'm going to say this, and if it steps on toes, I apologize. But if there's people on this call that know me, they'll be thinking, here he goes, he's going to say something that will upset the entire world. So I'm used to it. I do it. I can't help it. I'm sorry. We're very lazy when it comes to training. That's what I'm going to say. We set out the training matrix, we do it, we get staff to attend it, we see what percentage of compliance we are, and that's it. We don't do anything else with it other than really take it to CQC on request at that part. And then it becomes a tick box exercise in the main. I'm not saying everybody is like that. But if you were looking at it from an investment perspective, then what are you actually getting from this? And if you want higher inspection grades out of this, then you should be able to showcase how effective that training has been. And CQC love reports. They absolutely love you taking data, analyzing it, and showcasing how it's worked. So, for example, if I've had a large expenditure in safeguarding training, then at the end of the year, I should expect to see results that show we are a safer operator. We've had less safeguards, we've had less errors, we've had people in quality assurance feedback are stating improvements, because I've made an investment here to develop, and I should see results for that development. And you can do that once you have the data for everything. And again, I'll go into that in a moment. So in terms of answering that question, I'm sorry, Faye, and I'm sorry to whoever has asked the question if I've not answered it clearly. My recommendation would be a 3 year strategy, But if 3 years is too far gone, at least a 12-month strategy that you can report on at the end of the year with how that strategy has worked. Was there a second question, Faye?
Yeah, brilliant. So the final question is, who would do competency assessments?
That's a really good question. So thank you to whoever has asked that question. The answer is someone who's competent. It's as simple as that. So you don't need a qualification to be a competency assessor. You just need to know how to do it, and you need to know how to do it well and correctly. So let me give you an example here. I think too many times when it comes to competency assessments, managers, nurses, they want to take ownership of it, which is actually not a good development phase. Because if you're developing teams, then I'll put this in a simpler way, Faye. So let's take a standard residential care home. So I'll just push nursing homes and L&D services to the side for a moment, but they'll find some way back in. In a structure of a standard residential care home for the elderly, your hierarchy will go something like this: manager, deputy manager, senior staff, care staff. And then outside of that, you have all your auxiliary staff, kitchen, housekeeping, etc. like that. That's normally the structure. When you are promoting somebody to become a senior, then they are the person in charge of the shift, if you like, in charge of that time that they're in operation. And one of their jobs, or probably their most important job, is to be able to observe everybody that's working on their shift and making sure that they're doing things correctly and rightly. So if you make someone a senior, then you must have absolute confidence in them that they know how to do their job and they know how to do it the right way. So really the best person to competency assess people at that point would be your senior, because it's part of their job. If we give it to the manager to do, I'm sorry, managers, with the workload that you get day on day on day, it ain't going to happen. It may happen for the first 3 months, but you will not get consistency with it. And if you want to beat me up for making that comment, I want you to think back of every time a job lands on your table that requires consistent effort, how many times does it slip? Because you're very busy people. And it's the same with the deputy manager. So look throughout your care team and go, this person is very good at what they do. They're very competent at what they do. Can they competency assess? And by the way, there'll be lots of parents on this call. Elaine, you're a parent, yes? When your children were growing up, were you able to competency assess them brushing their teeth? Yes.
Yeah.
Why? Because you know how to brush your teeth, yeah?
Yeah.
We would hope. So on that basis, just look at it from the different skill sets of people. So to me, competency assessments are designed to be done internally. That's the basis, not externally. Externally is your training. There is competency assessments that will take place in classrooms when it comes to training, but that is based on, have they learned the skill? Can they demonstrate the skill? Can I give them a certificate for demonstrating that skill? But the people that work with people every day are internal to the organization. So your competency assessors should come internal. What I'm trying to explain is don't leave it at the high end of the scale. There's many people in your workplace that can competency assess. And how that feeds into supervisions and appraisals then is that if I've got somebody who's very good at competency assessing, they're learning how to give feedback, they're learning how to handle conversations that might be quite difficult, they're understanding how to give actions to people, then you are then helping them with their development to climb the ladder even more. And that's part of all development, because when they get to levels in management side, they will need those skills that I've just talked about to be able to become a good progressive manager. So I hope that answers the question. I'm happy to elaborate on that more to the person that has asked it, should they want it. But yeah, don't panic thinking we need an overqualified person to do competency assessments. You don't. You need a competent person within your workplace. And don't believe that you are the most competent person. There's people in my workplace are far more competent at many things than what I am. Absolutely. Okay, Faye, thank you for that. We're at 12:40 and I've got to move this along. So if anybody does want to ask a question, I will take them at the end, but just forward them on to Faye. And if Faye has any more, she can come back to me. If we run out of time, please, I think Faye may already have your email. I'm not sure from when you signed up, but we will feed an answer back to you if you do have a question. But for the time being, I'm going to move it on. So Faye, thank you very much for the interval questions. I'll let you disappear back into the background and I will crack on. I want to give you a scenario here, Elaine. I just did some rough numbers in my head before coming on, just to showcase why that when we're looking at training development, we should actually scrutinize what we're spending and how we're doing it. And again, this will link it back into competency. So I've looked at an average member of staff. Now, these are minimum numbers, okay? But I've looked at an average member of staff, and in general, the minimum amount of e-learning courses that they will normally do is 10. That's the minimum. That number, by the way, goes up. It doesn't go down, it goes up. And roughly with an e-learning course, they're normally about 30 minutes to complete in total. And certainly some of the organizations that I work with will pay half an hour for somebody to do an e-learning course. Now, if you look at the average cost of what you're paying for e-learning, and this is quite the low end of this, the average cost turns out that you will pay £2.50 to the e-learning provider for every e-learning course that you do. And that's including your LMS and everything like that comes with it. So roughly speaking, to the e-learning provider, for every member of staff, you're going to pay £22.50. And if you work out payroll, and I've just based this on somebody being on £13 an hour, they may be on more, they may be on less, depends whether they're clinical or not. So these numbers are very, very subjective. So I've just based it on £6.50. So just for that member of staff to do the e-learning, the total cost for the year to do those 10 courses is going to be about £87.50, give or take. They will normally attend free face-to-face training courses. We think about moving and handling, we think about basic life support. There may be other courses that they do as well, fire evacuation or fire equipment. So just based on that, 3 hours, on average, they do a half-day course, £300, but some of those prices can vary from £300 to £450. So again, we're on an upward scale. I've based it on 10 people attending, and if we looked at average numbers of attendance in classroom, it would probably be less than that. So again, that price would go up. Well, let's just base it on that. That means for every learner that sits in that classroom, it's costing them £30, and you also have to pay them for the 3 hours. So let's pay them £58.50. So the total cost, therefore, for a member of staff to do the face-to-face, it's going to roughly work out at £148.50. That's the lowest cost. So therefore, what you're normally spending per learner per year based on e-learning and face-to-face training is a broad figure of £236 per person per year. That's your investment. You may be sat there going, we spend more than that. You may well do. But on average, that's what you should be looking at in terms of your budget, which is why it's important that we draw down any courses that are not needed and are not necessary. Because if we look at a service that, say, had 50 staff, that would equate to a spend of £11,800 per year. And remember, this is based on lower numbers. So on average, let's say you were spending 50 staff, you're spending 12 grand a year. That includes e-learning, face-to-face training, and paying the staff to do that training or attend that training. So budget of 12 grand per year. Some of you may be spending way higher than that. So just remember this minimum. You can do this own costing yourself. I'm happy to send this slide over if somebody wants to play around with it and work it out for their organization. Now, before I move on to, okay, well, how do we save that money? And Elaine has mentioned about the importance of training reviews and looking if you're doing the right training or if it's needed or the validity periods are correct. I want to really focus on competency now on in, because this is where the big changing and turning point comes. So if you remember at first, I've stated quite clearly, you have to do competency. Okay, that's not me bigging it up. That's not me being an advocate of competencies. That's me saying you have no choice. You have to do competencies. So let's have that as a rule. You must do them, and we'll park it there for a minute. However, competency is not training. So training, when I've done that £11,800 remit, that's the training element or the qualification element. And every member of staff needs to do that as their foundation level. That's why you have induction training and things like that. So once we've got that cemented and we've got it in place, then the next stage is, well, how do we know they've learned it, and how do we know it's working, and how do we know it forms part of their working practice? And that's where competency comes into it. So training is imparting skills and knowledge, the foundation for competence, and competence is demonstrating the skills, knowledge, and attitudes and behaviors. So if we look at it from a pyramid perspective or the triangle, training would be the bottom part of the iceberg, and the bit we're seeing above the water, if you like, is the skills being shown and demonstrated. That's what we want to see. That's the visual part. So when we introduce competencies, what we need to now start doing is looking at, well, if staff have completed the training and we continually competency check them, then we actually only need them to do retraining. At the point where there's something new to learn, or at the point where they're no longer competent within it, we found gaps, we found weaknesses, because that's the bit that we now need to upskill them again to develop them. And there's many ways you can do that. It doesn't have to be a face-to-face classroom. Sorry, Elaine. It doesn't have to be a face-to-face classroom or a virtual classroom. That can be mentoring. That can be one-to-ones. That can be coaching someone. That can be having a buddying service available for them with other staff. So there's many ways in which you can do it. But the key bit here is that we only need to retrain them when there is something new or there is a lack of competence for that skill set. That changes the goalpost, and it's why Skills for Care absolutely changed a lot of their validity periods on the courses and introduced competency within it. I just seen a question come through there, Elaine, from David. Do you know what it said? It flashed up on the screen and it went. So I don't know.
Yeah, it says QAF quality assurance framework state that to complete competency assessments, you need to have a qualification above the person you are assessing and hold the relevant qualification within the field you are assessing. I don't agree with this. However, what guidance do you follow to state that you are competent to undertake the competency testing?
So what the QAF is talking about is qualification competence. So what we're talking about is working practice competence. So it's very different. So for example, when you're doing medication competencies within your services, you are not bringing an external provider in to do those, or somebody with an assessor's qualification to do the competency assessment on how someone is administering medication. If it was the actual qualification they were having, then the person that's training it and assessing it at that point would have to be a qualified assessor, similar to, I can go back to the days of A1, A2, but just on the basis of that, we as a service, when I get onto the main bit, and I'm conscious of time, so David, I will feed back to you direct on that, if that's okay. As a service, we actually offer, as part of our system that I'm going to move on to, a virtual classroom where it's training you to how to do competency assessments on the system and in the correct way. And with that certificate, that would allow you to complete the competency assessments using the system, but you would have to be very competent and showcase that within it. But ultimately, in terms of a qualification, you can do an assessor's qualification, but it's not necessary for internal competencies. So what is competence? Well, we're looking at skills, knowledge, attitudes, and behaviors. These are all the things that should sit within your competency assessments that you've built. So practical skills, practical assessments, understanding, rationalizing, and justifying your work, and putting individuals at the heart of what you do. They're all the things that when we build a competency assessment that we are feeding into. Again, this PowerPoint can be available if anybody wants it. So is the solution technology? Well, I think it is, and that's why I built Confident Competence, which I'm going to run through in a moment. And because it tackles a lot of the things that I've talked about early doors and how we move forward with this. You see, one thing that I am so focused on at this moment in time is making sure that we're getting bigger bangs for our buck. Now, on the example that I gave you earlier, I stated that, the cost of the training for that scenario turned out to be £11,800 per year. So I want to just very quickly talk to you about what we've done. So we've built a system called Confident Competence. Now, this is a full system with a full CMS, a competence management system within it. It has an inbuilt competency library. So all the competencies are already there to be used. They've already been written, they've already been qualified and checked. They already meet the relevant law, legislation, regulations, and good practice guidance. And it's all available to do the assessments via an app, which makes it very easy to do because it means that you can complete the competency during working practice times. It stops you having to go away and try and write them. It stops you, which will take you hours and hours and hours. And also with the CMS, you've got the full reporting suite that will come through on that. So for 50 staff, that system is £1,800 per year. Now, I'll come more into as we follow on, but let's say that 70% of your current staff are competent in different areas. So if we base that on the example of 11,800 spend, and you didn't need to put them back onto those training courses, you didn't need to make them redo that e-learning course at that moment in time, then based on my scenario, your saving or your spend now is going to go down to 3,540, which will give you a total saving after you purchase the system of 6,460. Now, do I want you to have that saving? No, I don't. Okay. No, I don't. What I want you to do is take that money and invest it into the skills that you need for them to actually develop further along the line. And that's where things like infection prevention control leads and safeguarding leads come into play. Your champions, all the things that CQC love, all the things outside of the statutory and the mandatory, your dementia advisors, customer service relation points, your mental health first aid workers. These are all the training courses that will develop your company, and there's lots of them. So what we're trying to showcase here is let's actually competency assess and pass the people that need to be passed on training courses where they already know what they're doing, and start to develop them by using the money we've associated to them as an individual to give them knowledge that they are unaware of that's going to help the business practice. And this is the importance about doing a training review and then forming a training strategy on the other side of that, and spending that money wisely so it delivers that return on investment. It's not just delivering the same thing, which is a compliance model. When we work with companies, we very quickly see where the savings can be, and we can very quickly train the competency assessors up to be able to do that competency assessing, because it's critical. So not only do you have to have this, which we parked and we know we've got to do that, but second of all, we can use it as a structure to form a training development plan that actually progresses people. And how does that link within supervisions and appraisals? Well, the data it gives us allows us to see how competent an individual actually was, and are they ready to be progressed in the pathway? Or is there other competencies that we can apply to them that are softer skills to see how they would handle themselves in certain situations and scenarios? And what can we work with them on, and what can we develop them on, and how do we support them? That's the initial part of competency. So there is a QR code on there that you can look at. I'm not, at the end of the day, I have an hour, so I couldn't show you the system that we've built. But what I wanted to do within this hour was to show the importance of actually starting to formulate that plan for all your training and not just keeping it to the side, almost in a what I would call a fixed mindset. In other words, it's taken care of, it's covered, we know what the fixed cost is going to be to it, and we just keep doing that every year, and actually pulling it out and popping it into a growth mindset of what are we actually getting for our money, and how is this helping to grow the company? And that's where companies like CBAT and Confident Competence can definitely help you. Now, I have someone on this call as we move into the last few minutes from a customer team at Confident Competence. So, Aaron, if you can just pop yourself on camera. Aaron is happy to give demos of her product to anybody that wants to see them or see the system. So what I would suggest, based on everything that I've just said, is that if you gave up 20 minutes of your time just to see what we've done and how it works and how it can help your business going forward and help with those cost savings, then I would actually grab Aaron while he's here and see if you've got a time where he can demonstrate it to you so you can actually see it in full working order. If you do that, that 20-minute time is not wasted, because at the end of the day, you may actually just want to speak to him more in depth around, well, what does the competency look like? Can you send me some samples, etc., like that? Wherever it may be, it's well worth having a look. But remember, you have to do competency. So even if you don't want to speak to Aaron today, you don't want that demo, I do want you to go away with the seeds that I said right at the beginning of this, those two questions. How are we currently doing this? And does it work effectively enough for what it is that's being required? So, Aaron, I'll let you introduce yourself to the good people on this call. And if anybody wants to reach out to Aaron or talk to him right now and want a demo of the system, he'll be more than happy to accommodate that and get that scheduled in. It is gone 5-1. An hour has gone already, and I know you poor people have had to listen to me go on for an hour and given up valuable time in your lunchtime. I do hope you have enjoyed it. We will be back again next month, and I will have a very special guest with us. We don't just talk about competencies and compliance on this. We talk about other things that are related to CQC, regulations and technologies. We bring on e-learning providers to talk about integration systems, etc., like that. So always stay tuned. You'll always hear something different. It's just today I wanted to really emphasize, because we've turned January 2026, emphasize the need to do your training development plans, utilize people like Elaine and Aaron, if you would, and really structure out that year. So, Aaron, I'm going to hand it over to you. I'm going to say goodbye to absolutely everybody. Elaine's coming with her hand up. So before I say goodbye, Elaine, did you want to say goodbye too?
I did. I wanted to say that obviously we have referred a lot to CQC today, but this is just as relevant to any children's services, especially with the new Ofsted framework and changes for the social care common inspection framework that came in November. So although if you might be sat there thinking, is this relevant to me in children's services? Absolutely is. But more than happy, Paul, and my email is on there to have a conversation with you. We're doing complimentary free training reviews to kind of make sure that we can get your 2026 off to the best start.
Lovely. So that is a thank you very much from me, and I will see you next time. And a thank you very much from Elaine. Please reach out to us. In the meantime, I'm going to leave you with Aaron. So I'm going to switch my camera off, leave you be, and you can handle the two youngsters. Lovely. Thank you very much, everyone.
Hello, everyone. As he's just said, leave it with the youngsters. That's normally how the world works, and I would definitely advocate that's a better way to do things. If you don't know who I am Aaron from CBAT and Confident Competence. I'm the head of sales here. Anything CC, demo-wise, stuff like that, I think I'm your person to go to. Obviously, Paul and Elaine are the absolute gurus behind this masterpiece. But as far as doing demos and stuff like that, they normally hand it off to someone with a bit more youth. In this case, it's me. I'm not sure if anyone wants to book a demo in now or would like to stick an email into the chat box so that we can reach out from there and then get a demo booked in. If you wanted to have a chat about it now, I'm more than happy just to sit here for however long it takes. I think Faye has put my email into the chat box as well. Now, obviously, you'll all receive an email off the back of this just thanking you to come the webinar. That will probably also have my email in it as well. If you want to reach out, that's fine. If you want me to reach out, just stick it into the chat box and I'll be more than happy to reach out to you where we can get a time sorted for a demonstration of confident competence so you can really see the benefits of it, what you can do on the system, how it can tailor it to your organization and how it can link into your e-learning platforms and everything else like that. Well, thank you everyone for your time. I'm sure you'll all be on the next one now that you know that Paul and Elaine can talk for an hour straight without any interruptions. We'll see you next time. Thank you.